And we try to connect them. So we try to connect them, right? And basically they share, right? So I was a support parent. I connected with a few families, and once a week I would reach out to them and say, hey, look, how's everything going? We would have conversations, we would connect. Because being a special needs parent or caretaker is super, super isolating. So we really, really emphasize connection, community here at Parent to Parent. So I forgot to mention that, and I think that's a very, very important piece of information that I forgot to mention. Um, Parents are tremendous resources, right, for other parents and families. Peer-to-peer supports are essential to families' well-being and positive outcomes for individuals with disabilities. Family caregivers are supported and encouraged here to maintain their individual identities and lives and to pursue their dreams. And caregivers are valued, right, in their communities. And by service systems. And this is demonstrated by ensuring that they have the supports that they need and the meaningful participation in these system designs. Families, service providers, schools, and the medical community seek, right, to achieve positive working relationships that provide a foundation to support individuals receiving these services and their caregivers. So we get grants, right, from different funding sources. We get grants from OPBDD through the FSS grants. We also get grant funding from the Maternal Child Health Bureau, and also Starbridge, right? They have a contract with Parent to Parent. We do Parent Training Information Center, right, in the Capital District and the Adirondacks region. And basically our goal, right, in OPABD's Family Support Service Program is to help families who are caring for a relative with IDD, to provide assistance and support for the caregiver, enhancing family stability, which is a big part, right, and fostering natural supports that help individuals to fully participate in their communities. And I think that's a common conversation that we all have, right, is to try to have our loved ones, this individual, to be part of the community, right? And a lot of the times our loved ones need that support. So we really, really, here at Parent to Parent, we really encourage families to be their child's or loved one's voice, right? And how would we do that? By just teaching them, right? Advising them, speaking to them and saying, hey, you can do this, right? So how do we do this at Parent to Parent? Like I mentioned before, we do information referrals to families and the professionals who serve them. We do a lot of training education, which is like the workshops and support groups. And then we also do the support parent training for a lot of families. Um, Also, the information referrals provided through a network of, we are a statewide program, so we have 5 different statewide offices. And we all have to be caretakers of a loved one with disability. And then we also have, like I mentioned, a bunch of support groups here at Parent to Parent. So we have groups for children in early intervention, topics about raising teenagers. Considering residential placement is a big conversation that we have here at Parent to Parent, because we help families, like I said, that have their loved one of all ages. That we support families in every stage of their loved one's life. We have a fathers group, which is a big one that we're trying to always encourage fathers, right, to be more involved in their loved one's life. We also have we had a Down syndrome support group, but it's not there right now, so I have to update this slide. With the parent matching program, like I mentioned, we train families to become support parents. And they have to be, right, a caregiver as well of a loved one with a disability. And when they volunteer their time, they provide that person that they're connecting with a safe listening environment and confidentiality, right? So we encourage families, to keep the conversations as open as possible, but as confidential as possible. Support parents, like I mentioned, right? We connect with other families by whatever way that other family wants to connect, either by phone or email. And then after being matched by the coordinators in the designated area with a referred family. And like I said, it's connecting, right? We learn by connecting with other individuals, other families. Word of mouth is a big way that we encourage families to learn, right? I think that I always encourage families to ask questions, right? So it's a big part. It's just really, really being inquisitive. And then support parents do not provide any form of medical advice or professional counseling, which is a big thing. Basically, again, with the support parents, it's non-judgmental, right? We're listening, we're being open, sharing information, right? Without bias. And then we encourage, right? Encouragement to determine what will work best for the family and the individuals. But we don't tell them what to do, right? We just suggest and listen. And also they understand, right? About different stages in the loved one's life. Of adjustment, of maybe of diagnosis, or any challenges that they're facing, including a lot of conversation about loss and grieving, right? Because some families that they've lost a child, right? So it's we hit every stage of the individual's life. So now we're going to be talking about the family to family grant, and the goal is to help families of children with special healthcare needs find objective, family-friendly health information and enabling them to make good healthcare decisions. And basically, what is the children with special healthcare needs? It's basically an individual with an increased risk for a chronic physical, developmental, behavioral, or emotional condition, and who also requires health and related services of a type or amount beyond that is required by children generally. So then how do we provide that, right? We assist families, right, and professionals in helping them navigate the healthcare systems one-on-one, right? I have conversations with a lot of professionals, and I support them and I provide them information, right? We do education and training. We do, like I said, the workshops and trainings to increase service knowledge, right? Family leadership skills and positive family professional partnerships. Once again, with the parent matching, we do support family engagement with systems building activities, which includes participation in various advisory councils and bodies that impact health programs and policies. And we do collaborations with other F2F information centers, family groups, and professionals in efforts to improve services for individuals with special healthcare needs. And it's basically the purpose of the program is to help parents of children with IDD to achieve increased knowledge in the range of special education options, because it's a confusing system, right? I think we can all agree that navigating the system is super, super confusing. It can be complicated. And thankfully here in New York State, we have more options than some other states. But with more options comes a little bit more confusion as to like, what route should I take? So a lot of the times I have conversations with families. I speak to them for sometimes an hour. They express what they're going through, their needs that they have. And based on that information, I'm like, okay, well, we'll try to, how about we try these resources, right? Try this path. Because I know for myself, when I started navigating the system when my son was officially diagnosed at 1.5 years, it was just like, okay, well, your child was diagnosed, have a good day, and it's kind of like, you're just kind of like, oh, where do I go? What do I do? Who do I reach out to? Right. And I wish that I had known about parent to parent when I was at that stage of, of really learning my child's diagnoses. And thankfully, I was that inquisitive parent. I was the parent that was asking questions at the earlier intervention programs, talking to other families, to other professionals in the school, right? So word of mouth was really something that I used early on without so much support to really navigate the system. So knowing how difficult it is with my lived experience, I try to make this process a little bit more easier for families, not as complicated. Like I said, once again, I cannot advocate for families, but I really, really just try to be that voice, be that ear to listen to, right? And I think that sets us a little bit apart from other organizations, because that's part of my role, right? My role is to talk and listen and kind of hold people's hands sometimes, right? So it's really, really, I get a lot of positive feedback by people saying, you know what, you really helped me. You really helped me with this information or with this maybe question that I had. So it really it's fulfilling as a professional to be able to help families that way. And like once again, we do personalized one-on-one assistance, information referrals. Our workshops and webinars are very educational, very informative. We also talk about topics on relating to education under the special education, right, realm, in regards to special education laws from Section 504s, early intervention to CSE, graduation and beyond, right, the transition period. And we always try to work in a collaborative manner. And our biggest goal is to empower families so they can effectively advocate for their child within the school system. And we also do trainings on that as well. So our grant contracts, we can do it. We do in-person workshops. We do it through. We do virtual webinars. We sometimes go to conferences, and they're available to everyone. Everyone that wants to join can join and learn. So like I had mentioned before, we have a few topics that we talk about. So the big one that we always talk about is guide for families, how to understand, right? How to access eligibility and understand the supports and services that OPIBD provides for families. We talk about, like I said, residential, transition, education. So there's a lot of topics that we talk about. We do a lot of trainings as well, educational trainings, Section 504s, transition, like I said again, discipline of students with disabilities, assistive technology as well, if they have it in IEP, advocacy skills, right? Like I mentioned before, we do a lot of talk about the organization of healthcare records, educational records, right? We always talk about advocacy because a lot of the times, like I mentioned, our loved one, they don't have a voice. Sometimes they're not verbal. So we are that loved one's voice and we advocate for them, right? We also do, like I said, family empowerment advocacy trainings, understanding your rights, effective communication for any meetings, reading the IEP, right? How to prepare successfully for any meetings, and how to have a great school year. And like I said, we also talk a lot about self-care for the loved ones. So preventing parent burnout is a big one, right? We teach families the importance of you as the caretaker really have to take care of yourself first before you can take care of anyone else, right? We use the analogy of, you know, when you're in an airplane and God forbid there is turbulence and the masks come down, what do they tell you, right? If you have a child with you, what do you do first? You put the mask on yourself first, and then you do it for your child, right? So we use that analogy, right? So first take care of yourself, and then you can take care of your loved one, right? And like I said, there is a conversation about grief and loss for parents that have lost their child with special needs. Also, understanding caregivers' perspective. So many of our trainings have been adaptive to promote understanding for caregivers' perspective within the professional community. We use our shared experience, where we're always sharing our experiences as caregivers, and how to interact, right, with systems of service, and how to build a trusting and productive relationship with family caregivers, including tips for better communication. And we also talk about sensitive issues for caregivers or known challenges in the caregiver professional service system relationships. So these are just, you know, what's new. We have, hopefully now for 2026, we're working on having new topics that we'd like to talk about with families and professionals. So I will keep you updated on those. I'm super, super excited about that for 2026. We also participate in the Mind the Gap program, which is a program through the University of Rochester. And it's kind of just like the same work that we do here, Parent to Parent. It's just forming another form of support for these families. I also participated before being an employee. I was a Mind the Gapper, like they called us. And it was just another way, like I said, like our parent matching program. It's the same concept of like we're connecting with families. We will be reinstating and participating again now in the beginning of the year. And it's like I said, more one-to-one support with these families, understanding what service systems they need, right? What kind of supports they need for their loved ones. So we try to connect them with those resources as well. And it's basically very tailored to the individuals of that family's needs. Supported decision making, right, is a big one as well, right? We were trying to train families and professionals on this alternative to guardianship. And like I had mentioned, right? So I run the BIPOC group, so it's Black Indigenous People of Color. So I provide support for that community. We try to do also language access. So I myself am the Spanish speaking coordinator. We have a Mandarin Chinese coordinator as well. We also have a coordinator that speaks, I believe it's Farsi. We have, like I said, in development, and we have it now. We have the LGBTQ plus parenting group that is run monthly. And hopefully now down the line, we will also have a support group for the Muslim community. What's next? That's it. I mean, simply said, simply stated, and I'm going to put back my information because that is not the information that I needed. I am Gabriela Burgos. Once again, I am the coordinator for New York City, also a Spanish speaking coordinator. So that's my phone number, my contact. Once again, it was a pleasure speaking to you all. Thank you so much, Ms. Pilar, for the invitation to talk a little bit about the program. And any questions, please, please, please feel free to reach out to me. My phone number is 646-766-3460. And my email's on the screen as well. So please, like I said, no questions, a silly question. Please reach out to me if you need any support or questions. And it'll be a pleasure to speak to you all. And once again, thank you so much for the invitation to speak to you all tonight.
Thank you, Gabriela.
Thank you.
Does anyone on the call have questions for Gabriela? I also put her information in the chat. Okay. Raised hand, Joanna, go ahead.
Hi, Gabrielle. That was amazing. Thank you for sharing this resource. I'm just wondering in terms of, I know you said there's no eligibility or referral requirements, but does your organization really focus on folks with IDD diagnoses, or just is it like a wider spectrum of special needs kids?
Anything, right?
Okay.
It's a gap, the whole spectrum of disabilities. A lot of the families that we serve are autism families, but we have families that have even rare conditions. We support them as well. I personally was working alongside the NIH a year ago. And I was, just supporting families or individuals also that had very, very rare genetic conditions. So, no, we support the whole gambit of special needs and intellectual disorders as well.
Thank you so much.
Thank you.
Good question. Anybody else have any questions? You can raise your hand, unmute yourself. It's not that many of us. Okay. One of the things that we've been talking about as the council is reaching parents and families. So I'm gonna just drop a poll really quickly in the chat. And I just want to see who's on the call, and if there are parents and families on the call, what information you guys are looking for. There's no right or wrong answer. It's just like a general check-in we would like to do. Okay, I see some answers. Right. About half of you have answered. I'm just gonna give it a few more seconds. Go ahead, August, you can just unmute yourself.
Hi, Pilar. I wanted to
Hi.
bring this up because this is something that I think we're experiencing more so now. So, a lot of questions that come in are about related services or in-home services, resources to those. Also, what I've been experiencing now are adult transition services into adulthood. Those are the two big topics that have been coming up. I'm not sure how many parents are on this call, but that's something that we've been experiencing here at the office. Supports around behavioral issues, ABA, speech, occupational therapy, some physical therapy, but not as popular, but a lot of concerns about transition services.
Okay.
I just wanted to make reference to that.
Yeah, I didn't add specifically transition because I know that, I focus mostly in adult transition from high school to adulthood, and I feel like I always tend to think from that lens. So I didn't even put it purposely but also because Trudy and Rochelle and some of the other co-chairs and stuff and the council members also mentioned like school age transition, right? From pre-K, kindergarten to middle school, all of that stuff. So I didn't want to put the word transition for that specific reason, but I know transition is a big thing, and we definitely will be discussing it in the upcoming meetings. So I'm gonna end the poll. I see most people answered, and we can share the results. We got 8 out of 13 answers were parents, which is great. I feel like that's the best that we've gotten in most of our committee meetings. So thank you guys. Happy to have families on the call. Yes, 13 out of 13 for our forums if these are helpful. The most popular service that people want information on is employment. So we are gonna definitely take that to Miss Jahida and Jillian. Myself, we are gonna be talking about employment services soon. We have that scheduled, I believe, for next meeting, which will be January. We're gonna talk a lot about employment, and obviously the overlaps between transition, adult service, all of that stuff. So we're gonna be talking about that. The next second, I guess, most popular thing was clinical services, and not far behind educational advocacy and then guardianship. So I appreciate everyone for answering this, very, very brief survey. This will definitely help us as a committee and a council to make more meetings and more conversations that are geared towards the information that you guys need and want. Go ahead, Rochelle.
Yeah, thanks, Pilar. This is really interesting. I wish I had been more familiar with Parent when my son was younger. He's 42 now, so we're at a little different stage of life. But, I am the family vice chair of the Brooklyn DD Council, and I work with a lot of different family advocacy groups also. And I wondered, do you have any relationship with the IDDO Ombuds office? And the reason I ask this, as a parent, what I hear and what I've experienced is the frustration of knowing, of applying for services, waiting forever to get authorization, or then getting a denial for services, just coming up against a lot of brick walls. And I know you can provide kind of supportive counseling around that, but really the only thing that's going to resolve that frustration is getting some concrete help with accessing the service, so that's why I'm asking, is there any relationship with the Ombuds program?
I always refer families to the Ombuds helpline. And like you said, Ms. Rochelle, it's very frustrating. I mean, I myself personally, when I was applying for OPWD, and I'm kind of scared to say, but it took me close to 3 years from beginning to end to get from applying to get the final to get the budget rolling and all the services running. And, I tell families, don't use my experience, because I did it when pandemic was like, I started applying, or I went to the front door session, the pandemic hit in March. I went in November, a few months before. So, I started the process and all that. And then, things were launching when the pandemic hit. So, closures and, people figuring things out and this chaos. So I tell families, I tell them, I'm very transparent with a lot of families in a lot of things. And I tell them, don't use my personal experience, but, it is frustrating, even now that, the state is being more, they're putting a lot of pressure on OPIBD to really get the ball rolling even faster for a lot of families. Because it can be also very discouraging. I think we can all agree, right? That wait, the big, like, okay, are they going to call me back? Are they not going to reach out to me? It kind of really deters a lot of families from even continuing. And I tell families, don't let that stop you from accessing. But I mean, I think we all try. I think we can all agree, right? If we're all professionals here, it's super frustrating, because you want these individuals to get these services. They really need it. They really need the support. They need, a lot. So sometimes I feel like I personally feel like my hands are tied behind my back, and I really can't, I wish I can help everyone and I can say, hey, look, we're going to do this, but, so yeah, I mean, we try our best here at Parent to Parent, right? We really, really try our best here to really not discourage them and not have them stop, and now thankfully with the ombudsman and those helplines, it maybe can help them, right? Not discourage them, maybe get some more, someone that can speak to them and really, just tell them, we're going to work on it. We're doing our best. We're doing that. But for me personally, especially with, the Latino community, there's a lot of more barriers, there's a language barrier, that can be a cultural barrier. So I'm really kind of like their cheerleader a lot of the time, right? To stop them from saying, hey, you know what, I give up. I give up.
Gabrielle, I have a question.
Mhm.
Before I get to someone asked a question in the chat. It says parent to parent. Does the person have to be a parent? Or say, for example, it's
No.
their sister, right? And that's their advocate.
No, because a lot of the times,
Got it.
the caregiver is not
Right.
a parent,
Okay.
right? It can be a sibling.
Yeah.
It can be a family member,
Okay. That's
right?
good to know. Yeah.
Mhm,
Because
mhm.
I'm sure people see the name and they think like, well, I'm not a parent. I'm the
Right,
aunt. Like, so I
right,
can't
right. I think
yeah.
because the term parent anyone can be a parent, right?
Yeah.
But yes, I agree. I agree that
Yeah.
sometimes, they see that and they take it literally.
Yeah. Well, I mean, yeah, that's why I asked, because I want to send it to also people, that I know. So in the chat, we have some discussion. Just want to talk about them. So the first comment was, I'm looking for it, hold on. Miss Tara Marie was mentioning she wanted to talk about how to advocate for your adult child getting employment. So the main important thing, I think, when it comes to employment, and this is something that why we're going to have a whole meeting around employment, right? Is because employment services are extremely complicated. There's a lot of different funding sources, there's a lot of different styles, some of what we call a discovery service versus actual job placement and development, and then job coaching. So a lot of parents and families don't really know what those things are. So we want to break that down. So I think getting as a parent, right, the best thing you can do about advocating for the employment services is really learning what the terms are and maybe like what the timelines are for employment services, as well as what's realistic for employment services, right? Employment supports are a lot less supportive. They require a pretty decent, level of independence for the person. The same way you or I get to work is the same way that person will need to get to work, right? So there's not a bus that picks people up. So stuff like that, for especially from a transitional point of view, someone who's leaving school and going to the adult world, those are also things to think about when it comes to employment. So I hope, Ms. Tara Marie, that you join us when we do have our employment conversation, because we are going to get down to what's a discovery service, what's job placement, what's actually job coaching, and we'll touch on some of the different types of supportive employment services and programs. There's a lot. The OPWDD has, especially now, committed to what we're calling, what they call employment first, meaning everyone should be getting the opportunity and access to employment instead of just sticking everyone in a day program, right? We want to encourage people as much as possible to participate, in our community the same way. So there's going to be a lot of changes to services like pre-vocational service versus pathway to employment. What does that mean? And how are they different? How are they the same? So that would be my biggest suggestion is, one, understand the terms about supportive employment, take a look at the different types of services, and then be realistic about how those services match to your child, right? Not everyone can just go straight into employment, right? Some people need a little bit more time. Some people need more coaching. And so getting familiar with those services and different types of programs will be a good step for advocacy. And so that's a really good question. So I will plan to definitely table it. We're coming back with a lot of stuff on employment. Ms. Jahida is going to be the one to lead that conversation. So we have a lot of stuff planned. We'll make sure to include advocacy in there. The next comment was from B. Huss. It appears parents are riding a ship in isolation. I went twice to HRA for Medicaid, fighting for Medicaid for my son. I'm waiting an answer. I only want straight Medicaid, not even the full services. I suggest organizations make a group according to ages, so it's easier to share information in regards to OPWDD, health insurance, schools, private school. My son is 3.5, and as a parent, I'm more interested in meeting parents who have kids similar to my age group. Absolutely. So Parent to Parent is a great, resource, because they can probably connect you with other parents of the same age group. The good thing about the council and the committees is it's a collaboration of different providers and services. So I work for HRC and I'm familiar with the HRC stuff for the most part, but Jahida is also on this council with me, and she works for SUS. And Trudy, she works for HRC, but she's in the middle high school and she has a whole completely different perspective because she's dealing with Department of Education. So we try to bring it together for certain topics, like advocacy, right? So we can all agree that advocacy is something that parents, we want you guys to get information about and also help parents. We do also talk about like OPWDD, eligibility, healthcare. We haven't just as yet, I think, broken it down in this specific group to talk about services for children under 5. And that's also because a lot of that falls into the early intervention world, and not always like the same coverage of things. And Rochelle, maybe you can correct me if I'm wrong here, but it's kind of like we don't really get to them in the OP world until after the early intervention, right? So,
That's right.
but we can connect people to some of these early interventions, resources and information. So,
Yeah. Just to add,
yeah.
the council's mandate is to look for every person
Right.
in Brooklyn with a disability from birth to death. And every type of disability. So we have a very broad mandate. And we do advocate around early intervention services, which for many depend on them getting Medicaid access, I think, as was, the person noted in the chat. And Medicaid is very challenging these days, particularly in New York City. HRA is giving people a very hard time, much harder than they used to, and people are really feeling it. So I am very sympathetic to what's going on with trying to get Medicaid
Yeah.
for your child at this point. And but persevere.
Yeah, I think my biggest advice as far as advocacy goes is it's meant to be difficult on purpose, unfortunately. That is just the way it is. That's the way the system is designed. And I think once you change your mindset to they're blocking me, to, oh, it's supposed to be like this. I'm supposed to meet this barrier. I'm supposed to get that barrier because that's how the system was designed. Then you can kind of move your steps, right? I think you can kind of adjust a little bit. The systems are supposed to be difficult. Like that's just how they were designed. Unfortunately, they say they're designed to help people, but they also have a lot of bureaucratic things, red tape, documents, that create additional barriers. And the more barriers that exist, the less people, can get access to it. So it's kind of like very hypocritical, right? They say, yeah, we want everyone to get these services. We want you to get these services. But we really don't want everyone to get the services because if everyone got it, then we would have to actually give it to everyone. So therefore, they put all these weird little roadblocks in the middle to kind of prevent people. And some people do give up. So that's why we have the council, we have groups like Parent to Parent, and there's plenty of other things within our communities that know that. And I think as somebody who tries to tell parents the real information, as much as I can and be honest with them, that's a big brain switch to once you understand that the system is built to have roadblocks in the middle on purpose, you can often advocate, I think, sometimes differently. Not necessarily better, but it definitely adjusts your mindset. August, go ahead.
I kid you not, Pilar, you took the words right out of my brain. We tell parents that often. The system is designed the way that it is. We can only control what we can control. So to your point, although these services are vast, a lot of parents, at least what we're experiencing, are that they are being denied for services, and we tell them that's the expectation that you'll probably be denied the first go around, but we help families develop their voice, help them to better advocate for themselves, and to request a fair hearing or to challenge when you receive a denial or a letter that your child's not eligible. So for all parents that are on this call, we are navigating, very challenging times with getting services. So do not allow a letter of denial to stop you at that point. A lot of the times when you go and you apply again or you challenge that denial, more than likely you'll get approved. Not saying every situation will be that way, but they want to see parents that are going to challenge and fight for the services. So if there's anything that's taken, please, if you receive a denial, request a fair hearing. Reach out to parent. We can possibly assist you. We can't advocate for you, but we can provide you more context, provide you with resources that can help you get the services that you're looking for. So Pilar, you literally took that straight out of my head. And a lot of parents are, because their expectation is not set from that mindset, when they receive a denial, they don't want to proceed forward with any other services. So I'm glad that you're sharing that with parents.
And I just also wanted to add that sometimes it's even just something simple, right? So when they do ask for a revision or an appeal, sometimes it was just simple of like, oh, you forgot to submit something, you forgot to sign a section, right? And so sometimes, I tell families, you got that denial, but ask for an appeal, right? Ask questions, ask why. And sometimes it can just be as simple as, oh, you missed a piece of information, or it can be even more. But I think like we all were saying, right? It's just, when we advocate, when we speak up, and you find the answer and you say, you know what, it was X, Y, and Z, then the parents are gonna be like, oh, okay. So can you teach me more about what I'm missing or what information I need? Or I'm confused about something, right? So a lot of the time just having that conversation and teaching them, right, educating them so that, when they do have that conversation, it's like, okay, now they're prepared, right? They're prepared, and then they can continue asking questions or continue advocating or fighting for that service.
I think one of the biggest things that also is a good thing to say is ask for the supervisor. If you're not satisfied with the answer, ask for that person's supervisor. And if that person doesn't know the answer, ask for that person's supervisor. And you can just keep going because everyone has a supervisor. So I think that's also like a really good piece of advice to parents and families. Like just because somebody told you something doesn't always mean that that's the answer, right? Sometimes it is. Sometimes that is the answer, and sometimes providers always, I know that some of us, are doing our best, and we are trying to give you the best of the information, but sometimes it's not the answer, right? So ask for the supervisor. If you're not sure, you're not satisfied with that, just ask. Go ahead, Trudy.
Yeah, so I'm very happy to know that we have parent to parent because right now going through a lot of changes in services such as the re-eligibility for Medicaid, right? That now we're going through it from a school level perspective, how parents are asking for assistance because some of the parents, my child has been waiver enrolled for so many years. All of a sudden, they want to find out if she still has autism, right? So there is, when you're a child, you have all these DOH forms that you have to complete. But why do I need to do this again? So here in our building, we are going to implement a small workshop for parents about re-eligibility in terms of the DOH forms because it's a different language. Like you have to be a social worker to understand, right? As a parent, what is it that they're asking me, right? The questions are very tricky and they are meant to trick you for you to answer it incorrectly. So then you are off the service. So, so we assist the families also in that aspect, knowing that now they have to do it every 6 months, which is a little bit crazy, to be honest, you know. But it's a teaching, it's a learning, right? Everything is teaching and learning all over again, because for parents who've had services for so long, you never had to go through that. As long as you recertified, as long as you had your Medicaid and you were up to date. And now everything is brand new as far as evaluations. And now with Medicaid and re-eligibility, you really have to learn how to fill out those Department of Health forms when you're a minor or when you're an adult, because a simple mistake, like August said, you can just be disqualified and you have to start all over again. So it's the training and learning for parents is so important, especially if we're serving the, students with intellectual and developmental disabilities and seeking service and maintaining. Maintaining seems to be more work than actually having it for, nowadays.
Yeah. I just like along the line, since we're talking about all this Medicaid stuff, which is obviously driving many, many, many people crazy at the moment, I'd like to give a little plug for Care Design New York is a care management organization, and they just did an In the Know session presented by their key eligibility specialist, who really is a whiz at all this stuff. And she did talk particularly about the issues in New York City HRA as well, and talked about the disability forums and all of that. It's posted on the caredesignNewYork.org, cdny.org. No, it's caredesignny.org website. I would encourage people to take a look at it. It went on for over an hour and a half because people had so many questions, but you don't have to. You could take your time going through it, but it might actually help you understand what's changed and what you need to look for. And, there's so many different variables when people become eligible for Medicaid under their parents or and get Social Security disability under their parents when their parents get old and gets this Social Security, because I had to go through a whole mess with my own son around that time, and I know many, many, many people do. So she talked in great detail about all the different circumstances. So I would really recommend people take a look at it because it was extremely informative. The other thing is, I will do another little plug, if I may. One of my other hats is I'm a member and executive committee of New York City Fair, and we're having a town hall tomorrow night on the CAS, the Comprehensive Assessment System, that everybody who turns 18 and is looking for OPWDD services has to have. We are not addressing the cans for children under 18, but this is going to be a roundtable format. We have 3 representatives from OPW who will be coming. We have provider representatives, we have family representative, and my colleague Carlene Braithwaite will be moderating. So we're hoping that we will get a little bit more clarity about some of the aspects of the assessment process that have been very challenging for individuals and families, and answer some questions or open up new questions. You don't really know what it is, but it's a rare opportunity to get all those folks around the table and talking about how it affects everybody in our system. So it's tomorrow night at 7, and if you go on the New York City Fair website, newyorkcityfair.org, nycfair.org, you can register. And I'll
Thanks,
see if I can
Rochelle.
figure out how to put it in the chat. I am not that technically
I
savvy.
wanted to mention something that was going on in the chat about provisional eligibility from OP. So this is for Bilal Hussein. Yes, so there was a different way in which they gave OPWDD eligibility, and I believe they gave it to people when they were like younger. However, I think what ended up happening was perhaps people were not receiving proper diagnoses, then they would go to school, and then there would be a different diagnosis. So I think that's why when we mentioned before also like early intervention services versus OPWDD services, there's a lot of like regulations again about like who can provide to whom and what. So like children under a certain age are still, mandated to be in school, right? Department of Education services. So that's also the reason that people are given a provisional eligibility until, Trudy, you could tell me exactly what's the age that it's.
Yes, actually, 7, and I'm saying
7 or
this.
8. Okay, yeah,
Yes,
7
between 7
years
and 8.
old. That
Yep.
is because people, I think it's a double-edged like thing, but it's probably to prevent misdiagnoses of people, and make sure that they're getting the appropriate services through the early intervention services, and Department of Education, so that people aren't fighting multiple systems. But I think also if you know your child has Down syndrome, you know your child has Down syndrome, it's an intellectual developmental disability. I don't really understand why they would give you provisional eligibility from that point of view, but I also understand why they are doing that as well. So that answers, I hope that answers the question. Davina and then August. Go ahead, Davina.
Hi, I'm a mom and I have a son with autism. He's 18. And I just wanted to comment because, yeah, the Medicaid thing is so confusing. I don't think I have to renew it this year because he's on SSI now. And I got a letter saying he automatically gets Medicaid. I mean, he had the Medicaid already, like from the Medicaid waiver. Um, but I'm like a parent that I join all these Facebook groups and email chains with other parents that have children with special needs. And there is a lot of confusion around the, Medicaid, application and the renewal forms. And it's confusing to me, when I graduated college, and then so as a parent, I worry like, who's going to do this for my son when I'm not around anymore? Like, because sometimes, depending on what kind of care manager you have, they don't always know either. And I'm just wondering, is this the care manager's role? And also for the other lady that commented about the care design, if the link could be provided, because I went on their website right now, I couldn't find it. But yeah, that's a question. Like, do care managers handle it? Because I mean, we're talking about people with disabilities that need help. Like, it's kind of ridiculous. They shouldn't be at risk for losing their services because of a confusing application,
Yeah.
you know?
I mean, I'm Trudy again, sorry. So, from a school perspective, the schools should be, first of all, communicating with the parents in advance. As Pilar was mentioning, transition, right? We shouldn't be waiting until 18, or you should not be waiting until 12 or 18. Transition has to start earlier to get you ready for it, right? So the care manager also has to inform the parent as to, hi, okay, your son or your daughter has reached to 18. Have you gotten in touch with the school? Let's get in touch with the school. Let's team up with the school and see what are we planning, right? I'm also talking from experience. I used to be a care manager, and with my individuals, I always ask in advance, okay, at the age of 21, 22, where are we leading towards? We have to prepare X, Y, and Z, evaluations, recertifications, touring programs. That is something that has to be a conversation, an ongoing conversation. I mean, transition is not about, okay, today you're going to fill out the form and you are set for tomorrow. It is an ongoing process. So,
Judy, not to interrupt you, but honestly, in schools, anybody who has an IEP, the year the child becomes the IEP that covers the year the child becomes 15 has to have a whole transition section in it.
That is correct.
Forget about 21. They should be doing this when the kid's 14.
And way before.
If not before, if they're waiting till 21 or 18, there's a fail somewhere. It's
correct.
And that's why, a lot of the organizations try to teach parents, like, when you're in from middle school to high school, like, let's look at that transition plan. What does it say?
Yes.
Does it accurately reflect what the child's trajectory could be, and all of those things? So don't, if you ever hear people waiting till 21, like, I don't know.
I agree 100%.
It's terrible. It's terrible.
Yes. You have to start at early
when
time.
they're 21. Oh my God. That's all.
Yes. It is very late. I agree 100%. And we at AHRC in our school, I feel like we preach over and over, get ready for this, do that. And some parents are ready to listen to the information, and some parents are not ready. And I understand. I'm a parent too, right? Some parents wake up last minute, unfortunately. Some parents wake up at a very early time. Some parents are stuck in the middle and they're disappointed because the process is not easy. But you're right, Lucille. Transition has to start very early. You cannot just get at 18 and what's the question, or 21. I agree 100%. So back to mom, care manager should be asking that question.
And the other thing is just, as a parent myself, all this stuff is complex, and everyone on here is probably somewhat of a professional in some way, right? Even a professional parent, and it's super complex. So it takes a long time to understand what people are talking about. So, like, even to know what a transition plan is, even to understand what a day program is, even to understand what the options are for employment, even to know what OPWDD is, like, sometimes that takes many times of a review for people to say, like, oh, now I get what they're talking about. That might be relevant to my family member, but if you just, start so late, like, it's hard. And I don't remember, right? Pilar said it's meant to be hard. Well, it is. And that's why all of the work that you guys are all doing is so helpful.
Well, I think if people wait until 21, it's going to be even harder. And that's a bigger, issue that, we, I think, as a community have been trying to address, to make sure that when people are in school, that this is a big part of their transition planning, that, you can get some of these services while they are in school. They're just not going to be as many, right? Like getting respite for families, or getting, community hub or something. There are other opportunities, and I think people just kind of rely heavily on schools, because it's all available at school, and then they're just like, yeah, I'll worry about that when they graduate. And then by that time, it's definitely too late. I get a number of those calls probably every day. And so helping those people navigate a system is extremely difficult.
I'm sorry, Pilar,
Go
I just
ahead.
wanted to really quickly
Yeah.
before you, it's also is because it's scary. You know, for a lot of families, their child's diagnosis is scary. Confusing, right? The system is scary and confusing. So, you know, when families who reach out to us here at Parent to Parent, and they're like, yeah, my child is 19 and I still don't have guardianship. I still don't have any transition plans, you know, and now they're rushing. You know, it's they're frantic, right? And it's scary, or sometimes they're just like, you know what, I don't want to do it, you know. So I just wanted to add that it can be really intimidating for a lot of families for many reasons.
August had her hand up, and then Nigel, I think, but he put his hand back down, and then Davina.
Thank you,
Go
Pilar.
ahead.
I wanted to touch on, I know we kind of started talking about transition, but when I rose my hand, or excuse me, when my hand was raised, I wanted to chime in about provisional eligibility. So that being from birth until the age of 7, I think the question that was posed was, why do you have to reapply, right? What I found and through secondhand experience with the emergence of ICT, AIM, NEST, Horizon, all these different programs that's intended to promote inclusion, a lot of children that start off in early intervention may not go into CPSE, or children that are in CPSE may not go to a District 75. So I think a lot of why, and not saying that OPWDD has stated this, but I think a lot of the reason why children are required to reapply again 7.5 before their 8th birthday is because with the services that are now provided to families, children may not need OPWDD services once they're getting related services such as speech, OT, occupational therapy. For a lot of us parents that are on this call, that is the goal for our children to no longer need those type of supports and can, attend general education. And some of them do. Some of those children that get the OPWDD provisional eligibility may not qualify because they don't need OPWDD past a certain point. So I hope that gives more context to why parents have to reapply. It's just because the services that are available now to younger children, it's intended for them to not have to require permanent eligibility down the line. The goal is for them to be able to matriculate into general education. But for children where that's not the case, right? Obviously, you want to reapply at the age of 8, or even parents. I always tell parents apply, and let them, deny you. But for some of those children, and as a parent, again, the goal is that your child will not require these supports and services. So I hope that answered the question. Just wanted to add my 2 cents to that.
It clarified it for me, so thanks. Nigel, go ahead.
Yeah, no, I just wanted to add that it's yeah, it is important for us to always be transparent to parents, to let them know that the system is kind of built to slow them down and for them to walk away. Um, but you have to get that thick skin to keep going. Um, because if you don't, then your child's gonna fall fall behind. But also don't let the system gaslight you into thinking that you're doing something wrong, which I think also breaks a lot of people. You could be the most educated person in the world, and I heard this at the OPWDD town hall a couple of months ago. This lady was saying, she's a doctor, and well educated, has all these tools to navigate the world, but she's going around in circles and she doesn't understand why this is happening. And then when you add, you see somebody with a language barrier, may they be, whatever it is. Um, Imagine it's probably like 100 times worse for them. So yeah, it's also, yes, being honest with families. They know that the system is broken, but don't, yeah, you can't stop. You gotta keep going. but don't think you're doing anything wrong too at the same time. So that's it.
Thanks so much, Nigel. Go ahead, Davina.
Hi, yes. I'm not sure. I think my question might have been a little confusing because I wasn't talking about transitional provisional eligibility. I was actually talking about the actual Medicaid application that comes around every year that you have to recertify for it,
Yeah.
and it's very confusing.
We were answering two separate questions. So there was
Yeah,
somebody in the chat asking about the provisional eligibility, and then also your question about the
yeah.
Medicaid.
So my
Yeah.
question was like, are care managers responsible to do that? Because I think it's a very confusing process. I don't think I have to do it anymore because my son has SSI now, but I'm not really confident that he would be able to handle that. In some years, I've had care managers that say, no, we can fill it out. And then other years, it's like, no, we can't. So that's my concern. Is it a care manager's responsibility when you have a person who may not be able to fill it out?
I know Rochelle wants to answer this one, so go ahead.
Absolutely. If the if the family is unable to do it, it is absolutely the care manager's responsibility.
Yep.
I want to
and
add that care management is a Medicaid waiver service, the primary
Yes.
Medicaid waiver
Uh-huh.
service. So in order to
Yes.
maintain the Medicaid status, right, so that you can receive the Medicaid waiver
Yeah,
service,
they want to get
you need
paid
a care
too.
manager.
Let's
So
face it.
without the care manager, none of it really works, right? So
Yeah.
they are the ones that are supposed to maintain the Medicaid and make sure, because they also are responsible to coordinate with the person's other services and make sure that their other services are received and getting what they're supposed to be getting. So I'll just give you an example. Someone applies for a program and their Medicaid is inactive. The agency, the provider of that program, is going to notify the care manager to get it corrected, right? So it all ties back to them. I think what some people might face is individual challenges with individual care managers. And unfortunately, it's a position that has a lot of turnover and a lot of not a lot of information and education to them before they start the job. So sometimes I give them the benefit of the doubt. I apologize to any care managers on the call. I'm biased, but sometimes it's also they don't know what they're talking about. So that's one of those ask for their supervisor
Just
conversation.
to add to Pilar, Ms. Davina, care managers do get an alert on in their when their Medicaid needs to be recertified at least 90 days in advance. So the care manager is supposed to notify you, hey, you know, your son or your daughter's Medicaid eligibility is coming up. Make sure that look out for that mail, look out for that form, and let's fill it out together. Some parents know how to do it, some parents don't, but your care manager is responsible. Yes.
Thank you.
Gabriella, you could go ahead. Yeah.
Sorry, I didn't hear you, but I wanted to say this before the conversation ended, but be that pushy parent, be that pushy caretaker, be that pushy guardian, right? Like Pilar said, there's a chain of command, right? Complain to the supervisor. Supervisor don't answer, their supervisor, right? And a lot of families, they're like, oh, I don't want to be that pushy parent because they feel, and sometimes it does happen, right? That these individuals and these programs, systems, whatever, they're like, oh, Ms. Burgos, oh, she's annoying. I don't want to answer to her. I don't care. That's my child, right? So be that. I always tell families, if you got to call 10 times, call 10 times, right? If you have to, make sure you send emails, right? Always have a paper trail, right? Because you have to have cross-reference, because sometimes I've come across personally where I've complained about something. I've had a question about something, and they'll be like, yeah, Ms. Burgos, we talked about X, Y, and Z. We never had that conversation, right? So make sure I always tell families also, anybody, always have a paper trail, always have conversations written, so that if you have to cross-reference something, you have the proof, right? So, but be pushy, be pushy, be pushy, be pushy is my last word that I want to tell you all.
Yeah, I think as a provider, I say it, sometimes people don't believe me. So it's nice when I have parents that can also tell other parents, like, yeah, you got to be pushy sometimes. And so what if they think you're annoying? That's fine. It's, that's the job. So, I want to thank all of you guys. Thank you so much, Gabriella and August, for joining us from Parent to Parent. I hope the parents on this call take advantage and reach out to you guys. I will continue to send people your way. And we got about 4 minutes. I don't think we have anything else left on the convo. Thank you all so much for your notes in the chat also. This is a great community, and we want to continue, growing this committee. So please make sure to invite your parents and families as well that you support, so they can join us for next discussions. Thank you guys
Thank you,
so
everyone. Thank you so much for
much.
joining us tonight.
Nice
good
to see
night.
everybody.
Have a good
Thank you.
night.
Bye-bye.
Good
Good
night.
night.
Laura,
Bye.
when are you
Thank
going to do
you.
the employment one?
I believe January, right, Jahida?
January, you said it. Yes.
Yeah, if not
Yeah.
January, February, but I have our
Oh, okay.
months planned out. So I'll send it when I send the new flyer for January. I'll send it out with January and February dates.
And
And
Pilar,
Shahida's going to have
will
her audio fixed then, right?
I was going to ask, are providers invited to attend that, Pilar?
I'm sorry?
Are providers invited to attend that employment workshop for employment segment?
Yeah, of course. Our providers are